Hello everyone. Today we have the opportunity to have with us Dr. Saad. He's an ST5 in Edinburgh and he's going to give us a strategy about his exam preparation. He passed his Section 2 FRCS in the May 2025. So, thank you, Dr. Saad, for taking out time for sharing your experience about the FRCS preparation.
My pleasure. No worries.
Can you quickly just introduce yourself? Then we move on to the preparation strategy.
So I'm just a trainee in east of Scotland. I've given my exam part MCQs in January and then part B in May. Usually, I think in the UK we give the exam in ST6, but I wanted to give it a bit earlier because I just like to get the exam done and I had the requirement, so just got it done.
Is it possible for ST5, like what requirements like they can achieve
There
it?
is a there is a curriculum requirement which is based on the JCIE curriculum document for urology trainees, and if you fulfill them, then your TPD has to approve it, and if
Okay.
they approve it, you can do it.
Okay. So you said you appeared for your section one in January. So how long
Mm.
did you prepare for section one? Because I did not know you were not connected.
Yeah.
And so you
Yes.
prepared it.
For the first part, I prepared about 4 or 5 months. So from around August, but obviously in the beginning you start slowly. And I think the biggest problem for most people when I speak to them is knowing what to prepare because there's so much content. There's hundreds of books, and the exam is just all of urology. So,
Yeah,
and then you slowly ramp it up towards the end.
right.
But I think you need 4 months. I think if you have 4 good months, you should be okay. But five is better.
But then what resources did you use? Like if we quickly take you to the section one preparation, I know it was long
Yeah,
way back.
yeah. Section one. So the main things I would use definitely was I did first round reading with the Oxford Handbook. Used the 3 or 4 MCQ books. So the Rafiq big MCQ book, the Manit Arya orange black MCQ book. Then there's the old PDF, the Procar PDF. Use that one. I think they're old questions, but still useful for learning. And then the Donati book, again, some reading from there. So combine that all. But I think the main thing in the first round of reading was Oxford Handbook.
Yeah, yeah. So Oxford doesn't include transplant. Okay, so
Mm,
many candidates they come and out they say that transplant has been a major bulk.
mm.
And some sessions they don't ask on transplant. Some sessions they ask on transplant. So did you face a lot of questions on transplant and
There was quite a lot, I
res-
mean, yeah, quite decent amount. About, I think at least in our exam in January, about like 5, 10 questions, I think minimum.
yeah,
But I mean, I heard about it from my senior colleagues who had given the exam the year before. I had to use some other tiny little stuff. So for example, for peds urology, there's a essentials of peds urology book. I didn't go through all of it, just parts of it which are important, like embryology and the pediatric urology bits of it, or the Weigert-Meyer stuff and all the common stuff. And then there's a transplant at a glance in urology or something. I can share the screenshot. I'm sure you know. Again, parts of it. It's a very concise book, so just parts of it. Um, I think in the beginning you just create an idea of what's needed in the exam, and then towards the end, when you start doing more MCQs, then you just basically add
yeah.
the information anywhere, Google
But
guidelines. You,
yeah, but whatever the candidates who appear for the exam, they have the one big question. Like all the MCQ question banks, they are backdated. They are not updated over the
yeah.
last few years. So where to practice from? Like you have solved multiple resources. If you have to suggest someone who is preparing, like you can practice from this source, what would
Mm.
you like? Would you recommend something or would you just say go everything?
I think the honest answer is that the type of questions in the exam are either very straightforward, 2 lines, and it's facts you need to know, or they're clinical. And if they're clinical, then most people will be able to solve them if they have good idea of the clinical
Yeah.
cases.
Right.
The basic science is one. The issue is that you can't replicate them. There's no good question bank. So the more you get knowledge from different places, the more you can try to use your analytical skills in the exam is more beneficial because it's not just about knowledge, it's about analyzing the question and trying to understand what they're trying to ask you, because a lot of the questions are not level one questions. Like they have, for example, for the kidney cancer questions, they expect you to calculate a Leibovitz score and
Okay.
then use that to prognosticate and then answer the question. So it's like 3 levels within one MCQ. And I
Yeah.
think for that, you just need analytical skills, which you can only get by doing a lot of questions.
Yeah, and that you can save time in the exam. Otherwise, you'll spend too much time, and
Yeah,
many people come back and they could not complete 10 questions, and it's
exactly.
very difficult for them to qualify. Once again, congratulations. Now we want this out for like you have been preparing for section two. How much time did you spend? So you passed in January. When did you start for section two preparation? Do you start like right after
So
the result?
no, so I think first section one was I think mid-January, and then the first month after that, we our results were like all a bit delayed. So 4 weeks didn't do any real studying because you were just too nervous about the result. And then the results came out mid or end of Feb, I think. But then when the results came, you start to feel a bit of relief. So you don't feel like studying. So I think I took another 2, 3 weeks after the exam. I think mid-March is when I started studying for the exam properly. So I think for the section two, maybe 2.5 months,
Okay.
2.5 months. It's like if people are giving it locally, the urology, FRCS urology BAUS course, I probably started studying like 3 weeks before that,
Okay.
3, 4.
So did you use your section one resources again for your section two preparation? Like what was your strategy for section two? Did you find the section one preparation, all the knowledge that you had? Did you make any notes during section one that you could revise for your section two?
I didn't make a lot of notes. A few of my friends made some notes, and I had some old notes. I compiled them out. I don't write a lot of notes, but I think it's difficult. I didn't use all of the resources from section one all the time. They were more like refreshing. If I was doing a topic and I couldn't remember, I would just go back, quickly revise, come back instead of doing it all A to Z. I think for section two, the more important thing was, I mean, it's the same knowledge. It's just trying to say the knowledge and also having it in your head so well that you don't think about it. Right? Because I think in the exam, a lot of people say that you need to not know this or not know that. But I think it's also a bit incorrect. You need to know a lot, but you need to know a lot very quickly. So when I was giving the exam, I didn't feel like I was thinking about a lot of the answers. They were asking and they were coming.
It should seem very spontaneous. Your answer should be
Yes,
very
exactly. Because and the questions they were asking, and I had to think. I think half of them were wrong because it. So
right.
it's either so a lot of the knowledge has to be very. You have to be able to just say it without even thinking a lot. And to get to that point, you need to have a big
Practice.
base. Yeah.
So how did you practice?
So I think we did your course, so that was useful, obviously, to sort of see how the questions are and your recalls and how other people are answering and good ticks from there. Some people, I mean, I don't mean to say anybody's bad, but some people are struggling with, what other people are not struggling with. So just combining all of that, then practicing with you as well. And then we had a small group. We made a 3, 4 people group about 3 weeks before the Viva course. Started doing once or twice a week, and then after the course, we were doing almost every other day of like 1 or 2 hours of practice. And so you do 1 or 2 hours of practice or 1 hour of practice, and another 2 or 3 hours if you can studying by yourself.
So it was twice weekly, or how frequently would?
I think before the course, which is like 4 or 5 weeks before the exam, it was like once or twice a week.
Okay.
After the course, we all got a bit scared. So you're doing it more frequently, like 3, 4, 5, sometimes 5 times a week. Yeah.
Okay, and that's great. But even after preparing everything, everybody always encounters some station which they are not very
Mm.
friendly or they are not prepared. Like this is not a very uncommon thing to find a unprepared station in the exam. So
Yeah.
did you find any, like you don't have to elaborate the station, but did you find any like
Yeah.
have you been very
Yeah, I
lucky?
think that one of the Pete surgery stations was a bit like very simple topic. We don't even like, nope, it's not part of any books because it's so simple, but because you don't practice it, it was a bit like, oh my God. But I think it's the exam, the way they run it, I'm sure you might agree, and I think most people, they 99% of people who are running the exam are nice people. They are not there to try to make it difficult for you. It might be difficult for you because maybe the knowledge is not there, maybe you're scared, but they are not trying to make it difficult. And I think a lot of people think that they're trying to trick you. Nobody's trying to trick you. It's very straightforward, very simple. It's more simpler than you think it is. I think the perception makes it difficult, and that's why the nerves make it difficult. So if you can, I know it's difficult to say for people who are not giving before they've given it. It's easy to say afterwards, but if you can just calm yourself and say, you know what, everybody's doing it, everybody's fine, we will be fine. That will help you more than not knowing the answers because it's none of the scenarios are really super
Yeah,
complicated. They're not going into, I think the depth of knowledge in the part one sometimes is super intense, like they're asking very limited. But in the part two, if you can cover 90%, 80% of the basics of a topic,
absolutely.
you will be fine.
Absolutely. That's a very important thing. I would like to emphasize that again. The examiners, they are never going to give you less marks unless and until you make a gross blunder in the basics. So
Yes.
the candidates who don't make it through, they might have done some mistake in the basics, and that must have given an impression to the examiner that he's not safe or he's not being very logical in his answer. When you move out of logics, when you move out of a rational and you talk about something irrelevant, then the examiners get disappointed. Otherwise, they're always there to help you. Every hint is not going to give you less marks. So if unless and until that the whole scenario you require prompting, then only the marks comes down. Otherwise, one or two hints are just sufficient.
Yeah.
Like it's not going to affect your performance.
Yeah, I agree. And I think some of them, I think the one thing they do which makes you a bit uncomfortable is they try to push you. So if you're doing good, they keep asking you.
Right.
So you start feeling sometimes that, maybe I'm not doing good, but actually it's a sign that you're doing good. It's just they want to test you to take you like to the next level of marks. So
Right.
like one random person asked me, I was doing priapism case, and they said, "What is the origin of the word priapism?" And I was like, "Oh, how is
that,
this urology?" Like,
that must
I
have been
didn't
the,
know.
towards the end of the Viva.
I think no, randomly in the middle, it was going in a good sequence. I think they just wanted to break my sequence, and then they were back to normal. But like sometimes they will throw these random questions, but I think the key is to not worry about it. As long as you're following a chain of thought and it's continuing, it's okay.
That's amazing. So you just spent 2 months to prepare the whole thing.
Two,
Like
3 months roughly.
most of them, they say that 6 months is even falling short. They're not able to manage. Like what matters the most?
I mean, to be honest, because I did part one and part two very closely, and I think a lot of my friends did very similar. A couple of them were in your course as well. I think part one knowledge, if you finish exam in January, you only have like 6 weeks in the middle where you relax and then you're back. So you don't forget a lot. You still have to revise a lot, but you haven't broken a lot of momentum. And I think it's a practice. It's a bit of knowledge. I think a lot of time people will say to you, it's more practice, less knowledge. I don't agree. I think it has to 50-50.
Right.
It
Right.
is because you can only be confident in saying something if you think you know the topic very well.
Right.
So it's also convincing yourself that you know what, like it's a mental battle with yourself more than anything else. You're like if
Right.
you can convince yourself you know it, you will do better.
Yeah, so whatever knowledge you gain during your preparation, try to simplify it. If you're writing down your notes, then try to simplify it and write in simple languages. Don't try to make it complicated in your Viva so that you can just elaborate all that knowledge in few sentences so that the examiners are convinced, okay, that this guy is going to know the concept about the behind the topic.
And I
So,
think it's sequentially. I think first when you start preparing like 6-8 weeks before the exam, do the basics, try to secure a pass, and then once you are comfortable with it, then you can secure other things. Like once you know the sequence of how to start a history,
right,
how to progress during a case, how to present your examination, how to do a differentials in your head to present to them, and then roughly know the management of all the big topics. And then you can say that, all the topics, I know the stem and I
right,
can survive it. Once you learn that and you can solidify that, then only go for like things like studies and big evidence and like or complications, because a lot of the time that's very backwards or
towards the end
towards
of
the end.
the Viva, right,
And to if you got to that point but you've done solid before that, you've passed it, in
right.
my opinion.
Try to know about the basics of the prostate cancer, how to take history of the prostate cancer, then management. People forget MRI, people forget biopsy, they straightforward jump to management. So these things happen in the exam stress. Try to bring all this into your reflex. And once you are done with this, then you read the trials in detail, know the basics about the castrate resistant, the metastatic prostate cancer, because you can keep studying prostate cancer for 2, 3 weeks. It's no point. The exam is going to just test 10 minutes to test your knowledge of prostate cancer. So whatever topic you are studying, so read the basics. That is what you are saying. I think that's a very important point everybody should remember. Read basics of every topic. And once you are confident with the basic, then keep adding simultaneously on every topic. So that by the end
Yeah.
of like first revision, by the end of your first revision, you have something of every topic. So how did you manage the last few days? Did you take leave from your work? Like, is it necessary to take leave? How much hours? How many?
I was fortunate the last week I had instead of I had 4-5 days off, so I was fortunate. I think, to be honest, I booked the leave like a lot in advance, thinking I will need it. But at the end, having the leave made me also worried because there was too much time and I didn't know how much more I can study, and you lose like the focus, or you lose the moment, or you just feel like sick of studying. So I guess if you don't have the time, you will panic more. So have some few days at least before the exam. And if you start feeling during that time that you're sick of studying, then maybe it's your mind telling yourself, you're okay.
So,
So it's a catch 52. Like if you don't take time, you will regret it. If you take time, then you will regret, oh, I've got too much time now. I'm going crazy.
So yeah, so those who are not able to take leave, for them, like they can even practice in their day-to-day life, in their even in their
Yeah.
workplace, they can practice when they're talking to the patients, they can think like it's a like they're counseling the patient as if it's an exam patient. So if somebody is not getting leave, then they can apply all the knowledge.
Yeah. Yeah, I think for the Viva especially, it's not like
Yeah,
if you're ready 1 week before the exam, you'll be ready 1 day before the exam. I think you'll even be ready like 10 days before the exam. I don't think the Viva is it you cannot change from a fail to a pass by like 4 or 5 days of studying at the end. It's
that's a very important thing, right? So you must keep your basics clear at least by 2 months and keep adding to it, get it better. Like your graph should go like we were discussing in the classes. The graph goes like this during the early phases of preparation, and then it becomes stable at a point. And then only you can add a few things in the knowledge, but your communication skills remains the same at after a particular point. Your pass and fail is already decided by that, like
yeah, yeah.
basics you have set. The higher knowledge of thinking is only for the 7 or 8.
Yeah.
That's
And yeah, I think also it's important to understand for part one and part two is understand from the perspective of the people who are writing the exam or the question, like what would they want from you? They want you to be somebody who is a safe early consultant, right? If you can be logical, you can be methodological in your speaking and in your decision making, that's all they want. So they're hoping that by the time you're coming to the exam, you know the knowledge, you know the skills. It's just making sure that in front of them, you are being reasonable, like a normal person. If you start becoming too smart or too silly in front of them, that's a problem. But I think 99% people or 95% people are not like that. So you just,
so somebody said that if you walk like a registrar, you come out like a registrar. So you should walk
yeah,
like
yeah,
a
yeah,
consultant,
yeah,
talk like a consultant, be normal, be
yeah.
relaxed.
Yeah.
And
And by the time people are giving the exam, a lot of them are like on that level anyways, because they're been thinking about consultant job or fellowship. So it's just it's just being comfortable that, you know what, I know how to do this. It's not a problem.
now I've seen even consultants, they when it comes to the exam, like in practice, they are doing well. They are doing very well. But when it comes to the exam, nervousness is always there. And maybe they are doing a subspecialty practice. And when it comes to
Maybe.
stations practice, it's like some stations they don't feel confident. And so you need
Yeah.
to this is an exam where you have to balance every station even during your preparation.
Yeah.
So are you in contact with all the patients? Like, do you deal with all subspecialties? Have you been
Yeah,
dealing
I
with?
mean, I think as a trainee, we have I've worked in a tertiary hospital, and this one's also tertiary slash secondary, so not super specialty, but we cover 80% of urology, most stuff. So you see on the on-calls and everything else, and you see benign and cancer. So it's a good mix. Don't see, I mean, I've not had a lot of experience in something like andrology, some, but not a lot. But that's only one station, and you
So
study so much theoretical. So
yeah, so that's a good thing. When somebody gives an exam early in the preparation, early in the like training years, it's also because they get exposure to all the subspecialties. It's
yeah.
easy for them to recall things. For candidates who are appearing in November, like 25, they have, I
Mhm.
think, 4 months left, 4 to 5 months. So what do you think? What should they do right now? And some candidates, some of our colleagues, they could not make it in May, unfortunately. But definitely, I told them they can do it. It's just an exam, like pass and fail can happen. Like it's a matter of luck sometimes. So what would you tell them? How should they go about this time?
It's difficult to give advice from somebody uh who's just gone through it but passed it. I don't know what difficulty they face. So individualizing advice is better, but I think it's my biggest advice would be that have the knowledge, practice the knowledge, but also say to yourself that it'll be fine and you'll be okay, because you can deliver, especially for the Viva, on the day if you are slightly calm and collected. If you're not like that, it's very difficult. And I think the way I convince myself is like if you pick up the results numbers um, of the number of people, like the JCIE published all the data
Yeah,
mostly every year about how
in
many candidates.
website.
If you see actually for the part B, the pass rate is better than the part A in terms of how many people sit it and how many people don't sit it. It's better, I know, for trainees than for non-trainees, but still, majority of people who give the exam pass it. So if you just make it like very rational, mathematics, statistics, um, most people who go will pass. So why can't you be one of them?
Yeah, yeah. And even I think the pass rates are getting better every year.
Yeah. So I think if you can use maths or statistics to say, you know what, odds are, if I flip a coin, my odds are much better than that,
Right.
then why will I not be part of this?
Perfect. Perfect. So thank you, Dr. Saad. Whatever you shared, I think for the last 15 minutes, all the important things that you have shared, everything is going to be important for those who are listening this, those who are going to appear for the exam subsequently. And congratulations once again. And thank you so much for your time.
No
So
worries. Thank you very much for your help throughout the journey. You've been very
I think
closely monitoring us,
I
helping
think
us, and
your hard work, it's your talent because you did in 2 through 3 months, which is very rare because I have been talking to many people. Like nobody does it in such a short time. I think your memory is good, or maybe
maybe.
because,
But I
your
think
communication is good. It's inherent.
if
It's
people are,
inherent
yeah, I
talent.
think if people are doing it directly from one MC without any break from
Yeah.
January MCQ to
I think
May,
yeah.
there's only 4 months anyways.
Recommend
Like
people.
so,
I recommend section one people. Like whoever passes section one, they should not take a lot of break in between. You never know
of
what when the pattern of exam can change. Any day they can
yeah.
change 16 station exam into a different pattern.
Course.
So
And most of the people I gave it, all the trainees, we all, if we pass, we just give it straight away because,
yep,
and most of us did the same thing
yep,
because you you give the mid-May, mid-January, and mid-May is the exam, so you only have 4 calendar months anyways. And once you give the first part without knowing you passed it, I don't think anybody in the world can sit down and study again.
yeah, yeah. So I think even for July exam, they are for section one.
Yeah.
So for them, any advice? It's just 1 month away. Section one.
Oh, section one is more difficult to prepare. I will be honest. I thought section one just yeah, I don't. I mean, just keep going. I think MCQs practice and repetition is key, just because of how vast the topic is. That's what helped me. I think if
Yes.
I did one topic only once or twice, I only remembered 80-90%. But once I did topics like 3 times and
Yeah.
then MCQs of those 3 times, then it started to become like a combined information in my head to like a jigsaw was coming together, um, which is the biggest problem with part one. You just keep forgetting. You read and then you forget.
What about the guidelines? Did you read a lot of AU or NICE
Towards
or
the end, yes, towards the end we read quite a bit because I was preparing with another friend of mine, and we would discuss what's difficult, what's not. I think last 2-3 weeks we did a lot more guidelines, a lot more evidence about
to
why
add
this
on
is
the
what.
knowledge? Mainly to add
Yeah,
on the
we
knowledge
were
and
adding because the basics were there, the algorithm of what is was there. So it was adding for those difficult questions and just revising the basic sciences, which is a headache. It's tough time. Part one is not easy, I think. Part one is
yeah, for so just I would like to summarize the basic thing. The basic message is clear your concepts well, keep the algorithms ready. If you are preparing section one, think that you will be appearing for section two after 6 months. So you, if you're making notes, make it in such a way that you can use it for your section two. If you're making algorithms, keep it clear so that you can use the same way, same thing for your section two preparation. And for section two, you need a study partner, you need a study group, a short group of 3 to 4 people, and you need to keep contributing. Each of you should be contributing. And I think Dr. Saad was in a study group and all of them passed in the group. That is
yeah.
the,
Our group was fine. Yeah, I think yeah, that's key. Just
yeah,
perseverance. I think it's an exam of perseverance, and you have to consider it as one exam. Section
mhm,
one, section two is one exam. You
perfect.
have to persevere, and most people are fine, I think.
That's the most important take home message. It's a one exam, and you need to keep thinking of when you're appearing for section one, keep thinking that your section two is just after it, and don't delay, don't take a lot of break in between unless and until it's required.
Of
So
course,
don't
yeah.
break between the two sections. So congratulations and thank you once again, Dr. Saad.
Thank you very much. Thank you. Well
Uh,
done, and thank you for your help. And you're doing a good,
I think
good
no, you
course
deserved
setup.
it, and yeah, we are always there to help, and
Thank
we'll
you.
stay connected, and we'll meet
Yes.
some in a
Yes, of
conference.
course. If anytime you're here, please.
Sure.
Cool. Thank
Okay.
you.
Thank you.